Now, Nigeria last week switched onto the fourth phase of a graduated series of restrictions as it battles to stave off the possible entry of the deadly Indian variant of the COVID-19 virus. But as it turned out, it was too little too late, following confirmed reports that two states, Edo and Osun, were already playing host to carriers of the variant. In a swift reaction, the country's Public Health Institute, the Nigeria Center for Disease Control, issued a statement assuring that with the preventative interventions being ramped up, there would be nothing for the public to worry about. How can the effective application of the new restrictions help in nullifying any chances of a community spread? Joining us now here in our Lagos studio to have a chat is Dr. Rukevwe Ugwumba, a consultant on family medicine and associate professor at University of Saskatchewan Medical School. Welcome to the program, Doctor. Good morning.
Good morning. Hello, Tindu. Hello, everyone.
Morning. Good morning. Well, Dr. Ugwumba, it's good to see you again. Very quickly, we would like to have your assessment of the Phase 4 guidelines and restrictions the federal government of Nigeria has put in place to prevent or to check, a third wave. And again, I would like to draw your attention to a front page story in this day newspaper of today, wherein the president of the Nigeria Medical Association and Professor Oyewole Tomori, leading virologist, are both saying that yes, those new guidelines and restrictions in themselves will not serve any purpose, except there is proper implementation and enforcement, and also that the concurrence of the people will be required. What's your assessment?
Yes, hello. Thanks once again. The last time I was here, we had a bit of an exchange. That's why I remember Tunde so well. Anyways,
I'm glad I'm memorable.
When we fought over vaccines. Yes, Professor Oyewole is absolutely right. The problem with Nigeria is not making laws, it's enforcement, really. That's what it is. Because whether we're going the fourth restrictions or the first or the second, if you never enforce them, then you're not doing anything. There's a few facts currently about the COVID. We know the vaccine and the virus is mutating, and there's several new variants, and some of them are very, very infectious and extremely deadly. 400,000 people dying in a single day in India is quite alarming. So it's interesting that some things may be working in this country, because the NCDC released just yesterday, they only had 7 cases and 0 deaths. So maybe something is working in Nigeria. But I like I said, I'm very much in agreement with the Prof that we need to enforce what is already there. Now, I know there's a new law to restrict movement between 12 a.m. and 4 a.m. And it makes a bit of a mockery as if COVID only moves in those late hours. So I'm not really sure if that's a security issue or if that's related to COVID. But restricting movement is one way for people that are high risk. So what do you do to stop this pandemic? So the first thing is testing. The 1-2 punch of this virus ending, you have to test and you have to vaccinate. We know that we're looking for herd immunity, and now they're saying about 20% of the population being vaccinated will provide that herd immunity. Prior to that, we thought if you got the virus, you could achieve herd immunity. Now we know that it's not really true, that getting the virus, you may get a second variant and you could actually die from getting the virus again. So we really need to vaccinate everyone. And of course, I will talk a little bit about that. So going down to this fourth lockdown measures or whatever we have, it's a bit of a double-edged sword, because there's the financial implication of doing more restrictions, and of course there's the psychological part of it. And at the same time, if you're not doing some restrictions for the categories of people who will spread the virus, then you're going to have a very bad situation in Nigeria, because we know we don't have the ICU beds, neither the oxygen. we don't have the capacity to look after very sick people who would get COVID. So I'll just talk about the 4 groups of people that are really the ones we should be watching. There are ones they call the refusers, the deniers, the young people, and then some cultural, tribal beliefs. Those are the 4 categories that will really put us at risk. And law enforcement needs to come in for those people. I would say the refusers are those people who know that there's a pandemic, but they say, oh, no, it's not going to happen to me. I'm a healthy person. And those people deliberately break mandatory rules and laws. For example, they travel, they don't do the enforcement of the 7-day mandatory isolation and things like that, and they have not received the vaccine. The deniers are those people that, don't even believe that there's a pandemic, that is all a hoax, a government way to chop money, if you will, and how things are done usually. And that is also a very big risk group people. And those people will not even want to take the vaccine. For example, I had some cousins recently who said, Auntie, there's no COVID. And when they were convinced, when some of their friends died, and if I'm saying young people, they now want the vaccine, and unfortunately it's not available in Nigeria. They're talking about back to the young people, the 21s and all those people who don't normally obey rules very well. Those people may get the virus, become very mildly or not ill at all, and spread it to vulnerable people, and they will die. And the final one is this cultural beliefs, religious beliefs, tribal beliefs. Really I've heard some religious people saying the virus is a devil, or it's a lie, or all kinds of things. Anyways, those people are putting us at risk, and law enforcement must enforce what is existing. Making new laws is not necessary, because we know that isolating, using your face mask, social distancing are the ways to stop the virus while waiting to get the vaccine. We know the vaccine is the answer. We know, for example, in Canada, where I'm coming from, we have stopped giving the AZ vaccine. We had 3 vaccines approved, which is the Pfizer, the Moderna, and the AstraZeneca. But we recently pulled back the AstraZeneca, which unfortunately is the only one available. Not because it's not effective against COVID-19, because of the VIT, which is the vaccine-induced thrombocytopenia that's killing people. It's a very small risk, but 1 person dying is 1 person too many. So we stopped giving the vaccine, AstraZeneca, in Ontario and in many places in Canada. But we think that if you got 1 vaccine, you should get the 2nd dose of the same vaccine. And I think currently it's only Johnson & Johnson that has a single dose. So now how do you now give a 2nd dose of the vaccine that's causing VIT or killing people, no matter how small? Now, that's the big question. So we're talking about mixing and matching vaccines. I heard recently from a reliable source that Nigeria is expecting 27 million doses of the Pfizer vaccine. And I was very, very excited, because we're rating Pfizer as one of the, the A-rated vaccines. But how are we going to distribute it and store it? That remains to be seen, because I know the deep cold chain that's required means once you thaw the vaccine, you must use it within 48 to 72 hours, otherwise it's useless. And so the transport and handling of that Pfizer vaccine is really critical. But I'm very impressed and happy with Nigeria trying to do that. I've always said on this platform that we must have various types of vaccines, because we know that the virus is mutating. And if we have herd immunity, where people have different antibodies against the virus, we will end this pandemic. Now, we know that Indian variant has been tested against the Pfizer vaccine and been proven to be 100% effective. Yes, we're still worried about the COVID, whether it's going to become a seasonal virus like the flu virus, and if we'll need boosters or not. But so far, the research is out there, but we're not quite sure that that will be the case, because once we get the herd immunity, which we think is about 20% of the people vaccinated with 2 doses of the 2-dose vaccine, at least the 1 dose of the 1 vaccine, then we're getting somewhere. I'll stop here.
Well, Doctor, you just mentioned that Nigeria is hopefully getting 27 million doses of a Pfizer vaccine, which is great. Beggars can't be choosers, and unfortunately, Nigeria, with regards to the vaccine, we are beggars. But it's still a drop in the ocean, and because of what's happened in India, we cannot get vaccines, the AstraZeneca vaccine that we were relying on previously. Now, I want your take, in view of that, on the comments by Minister of Health in the UK, Matt Hancock, that the Indian variant will spread like wildfire, he says, through unvaccinated populations. What do we do?
Well, how do we prevent the virus in the first instance? We didn't have vaccines initially, even at least for the first 8 or 9 months of the virus. We didn't have vaccines at all. And countries like Canada, where I'm from, we had very low rates of spread. And that's because we were doing social distancing, wearing masks, sanitizing, washing our hands. So hygiene measures. So that's how we'll prevent the virus from spreading. We know that in India, they didn't have a very high caseload initially, and they were acting normally. They were doing the Ganges River baths and all those things. And of course, the variant came and killed hundreds of thousands in a single day. So their practices, your simple, sensible practices that have been issued right from the beginning, should not be stopped. You know, I know that there's some recommendations now that if you've had your 2 doses of vaccine, you can stop using face masks because you're not going to, even if you get exposed to the virus, you know, you're not going to be able to imbibe it enough to infect either yourself or others. So that's what is being looked at the moment. Yes, unvaccinated populations are very much a high risk, especially if they do not follow the guidelines. So I know the markets are open, and I know that the social scene is open, and I know in a lot of places we're not doing the 6 meters or 3 meters. I don't know what the recommendations are regarding social distancing, but they're not using masks, and I didn't see a lot of people using hand sanitizers either. So these are issues. These are issues, and yes, God help us. We don't need to catch on to this virus. So far, like I said, I'm excited with the numbers the NCDC put out, but how believable are they? How much testing are they doing? Because we know testing is how you find cases, and contact tracing is how you find cases. When I came into this country, I haven't even received a text yet as of today. You know, I don't want to tell you when I came in so that you'll not be wondering if I'm if I'm obeying the rules, but I'm be fully vaccinated anyways. But the truth is, we are not enforcing anything in Nigeria. The law enforcement part of it is shambolic.
All right. Thank you so much, Doctor. But for some clarity's sake, you said that 400,000 deaths per day in India. The total death in India is 274,000.
No, there was a single day that they had 400,000 people die. So I don't know.
Yeah,
2 weeks ago.
Yes.
274,000 deaths. I mean, that's just the cases here, as you can see out there on the website. Maybe that means India will, maybe 400,000 cases anyway. I just wanted to clarify that.
Not cases, deaths.
And you keep saying, secondly, you keep saying that Pfizer vaccine is #1, is A-rated vaccine. I mean, what do you mean by that? You know,
well,
that was the little back and forth we had the last time. What do you mean by that? Please expatiate on that. The Pfizer vaccine is A-rated vaccine.
I say that because right now, Pfizer has been approved to be given to 12 and 16 years old, which is an official approval. No other vaccine has done that. I say it's A-rated because it's one of the first that came to the market, it's the most researched, and it's been most tested on even pregnant women and found to be safe. Not because any vaccine, to be honest, any vaccine is better than water. So even the AZ vaccine causing all this trouble and all the controversy we had the last time, even the Johnson & Johnson with a low 56%, what's it called, protection because a single vaccine is better than 0%. So yes, I stand by Pfizer being the best one to get if we can get that, because it's very well researched and it's been approved now for even the younger age group. And I think as more studies come out, we can even lower the age group. And that's the only vaccine that has been approved as such.
Well, you're absolutely right, Dr. Ugwumba, and that's why, you know, Pfizer is even applying for what they call biologics license in the United States, beyond the emergency regulatory approval that they have. And I like it when you talk about Canada, when you say Canada, where I come from. I see so much pride. I hope when you are in Canada, you speak about Nigeria with as much pride.
That's why I'm always back here. I love Nigeria.
Okay, but very quickly, I mean, with all that we have on the table now, what advice will you give the Nigerian authorities, either at the federal level or at the subnational level, in terms of what needs to be done about vaccine hesitancy, you know, about all the myths that we have, and strategies that need to be adopted going forward, testing, whatever, you know. What do you think?
First of all, I want to challenge you, Ruben.
Yeah.
The catch-22 situation is media. You have a big role to play in this pandemic.
Okay, we get blamed for everything. We're used to it.
This is no blame. This is a bit of a challenge.
Okay.
The catch-22 means you expose, what's going on behind the scenes. You go and meet the people who have been infected, and then you talk to them. And sometimes that raises fears, and sometimes that allays fears. So that balance between informing and alarming is really have to be gotten right in this COVID pandemic. The vaccine hesitancy comes from the fact that people don't believe, like I said, the refusers, the deniers, and young people who feel that they're very healthy, and a lot of them have died. So the media has a big role to play in this, and I won't take anything away from you. That you guys in our Rise TV do a very good job. Some people don't do as good a job as you guys. Now, going to the advice for the government. I would say let's focus on law enforcement. When you say something, let there be some consequences for that. If you do that, people can see that you're serious and you mean business. For example, I would give you an example. I'm traveling to Nigeria, and you won't believe I have to go through England, and from Toronto to London, Heathrow to Abuja. And I'll say this, I'm checked vigorously for all my compliance, my COVID test, my payment, or my isolation. There's a tracking form for the UK, even if you're just in transit. And you put all this information down, and then you come to Nigeria, and this is where you're ending and landing, and nothing. They would just look at it, oh, did you pay the 49,000, or I don't know how much it is I paid. Yeah, it was 52,000. I think it's dropped down to almost 39,000 or 40,000. That's all they're interested in. Once they can see your barcode that you paid, you're in. And that is alarming to me. So that tells me that you're more interested in the commercial side and not the actual risk that the travelers put into the community. In Canada, when I go back now, I'll be under a mandatory 3-day hotel stay because they don't know about my status. I'll be tested at the airport as soon as I drop, and I'll be given this 3-day stay. And if I test negative, I'll be released for another total of 11-day stay, so inside 3 days. So 14 days mandatory quarantine is still on in Ontario. And even if you're going to a final destination, say you're going from Ontario to Saskatchewan, where your final destination is, you must stop in Toronto. Do that mandatory stay before you go on the connecting flight. So you can't just go, because you can be spreading the virus because you came internationally. That's a big risk. Not the plane, everyone is presumed negative. But where did you go? And how do you have the virus? Are you incubating the virus? There's nothing like that here. So really, like I said, if we get serious about enforcement, we'll have no cases. I believe in that.
Dr. Ugwumba, on that note, would like to thank you very much. I hope the relevant authorities are listening, or that they will listen. Thank you very much indeed.